can you tell us what the quality of your life has been before and after your fibroid treatment?
Before, well, and the funny thing is that there were a lot of things that after were so much better that I hadn't thought I was experiencing before. One of the things in the questionnaire was, do you feel bloated or distended or pressure, things like that. And I guess that kind of crept up on me, you know, because fibroids grow. So I think that I got accustomed to it. The things that really bothered me, the thing that brought me in, was I had to pee all the time. I had to pee all the time. I couldn't sit through a movie. That pregnant lady in front of me in line, she was going down. And that was mostly my major complaint. But everything kind of changed afterwards. You know, I came in and I saw Dr. Rahman after the fact, and he was like, "How are you doing?" And I was like, "Skilly-doo-doo, skilly-doo-doo." I really honestly thought I was having some kind of placebo effect, you know, some sort of like extended euphoria. And it was because so much was different for me. I mean, really, so much more than I thought was wrong. I had just gotten accustomed to it.
So prior to your treatment, had any other physicians or medical personnel given you any direction or any recommendations for treatments?
Yeah, my own gynecologist, who I really like. She's a terrific doctor, very frank, but she's a traditionalist. And I don't think that, I'm not sure that doctors in general know as much about the treatment options that are available as we as women would like them to know. And the first thing she said to me was, well, I waited a really long time to go in. So first of all, it was gigantic. And she kept on calling it a tumor, which of course freaked me out. And then she said, well, I think you should just take your uterus out. And I was like, take my uterus out? And she said, yeah, hysterectomy. That'll take care of it. And I was like, wow, that's okay. Let me go home and think about this. And I went home and immediately got online and started looking up what my options were. Because, you know, a hysterectomy, I'm sorry, you have a rash on your hand, you go to see a dermatologist and they say, let's get rid of that hand. That rash might come back. We better take care of that. We'll take care of that permanently. Let's just get rid of that hand. And that was kind of my feeling, was, yeah, the fibroids might come back if I explore other options, but you're going to take my whole uterus out. I think I might want to keep that. I don't know if I have plans for it, but I think I want to keep it, you know? You never know.
So can you tell us about what treatment you did undergo and what the recovery time was like, what the procedure themselves were like?
Well, I had to use 2 different procedures to take care of my fibroids because the one was pedunculated. What is that? What is the
Pedunculated.
Pedunculated. That was the really big one. Although I had several large ones, but that apparently was not. You can't or you don't, as a rule, treat that with the HIFU, the MRI-guided focused ultrasound. So I did the MRI-guided focused ultrasound first, and that treated most of my fibroids. And then it was supposed to be strictly robotic arm myomectomy, and it was too big and too dense. So they had to give me a more classic myomectomy. So I've got that bikini scar. So I have all the little tool scars and then the bikini scar as well. So, yeah.
And how was the recovery for each of those procedures?
Well, the HIFU, I could have a HIFU today. Go home tonight and cook dinner. Literally. I mean, there was no recovery for that for me. And I think as a rule, there's no recovery for that, right? I mean, I think that's a very simple procedure. The myomectomy was a more extended procedure, a more extended recovery because it's a surgical procedure. So even though I just stayed overnight in the hospital, and I recover really well, we talked about that. So I didn't really require a lot of drugs, and I wasn't in pain. Well, I wasn't in what I think of as pain. I think you're continually screaming if you're in pain, and you really want drugs. But yeah, so I was obvious discomfort, but not terrible pain. But I couldn't do my normal exercise routine, which I'm training for a triathlon, so that was pretty devastating to me. I had to put everything off. So I couldn't do sit-ups, I couldn't run, and it took about 6 weeks for me to be able to transition back into the level of exercise that I was doing, which is probably a little crazy. I would say if I wasn't training for a triathlon, I'd say that 3 weeks was probably, and after a week I certainly felt good. But I didn't want to eat food for 4 days because I was worried about that.